Next, I'd like to introduce Dr. Christin Renolds. There you go. So you have you're in there.
Good morning. I'm Christin Renolds, and I first want to say thank you to Beamer and to Dr. Burka for inviting me here, and a big shout out to Callie Crone for connecting all of us. So I started my career as a conventionally trained family physician through the University of Wisconsin-Madison. And then life took a turn, and conventional medicine was not enough for me, for my patients, or for my family. I pursued a fellowship in integrative medicine and training in functional medicine, and a lot of other training in oxygen therapies. And I now provide integrative and functional medicine consults in a conventional healthcare setting, where I also serve as a faculty member for a family medicine residency program. Energy medicine has really become my passion over the past couple of years, and after 19 years in practice and attending a lot of big conferences like this, hearing from amazing speakers, reading, listening, learning from my patients, I feel like the secret of all this has kind of come down to two things for me: oxygenation and detoxification, which is exactly what Beamer does. 30% increase in blood flow, 30% increase in oxygenation, and 30% increase in waste removal. So what a great tool to add to my practice. So my story is, over the past 4 or 5 years, there's been an incredible amount of stress. My 12-year-old twin daughters have been quite ill with chronic Lyme and tick-borne illness. And over the past year and a half, it was incredibly intense. They went from a bedridden state to functional through the use of energy medicine, augmenting what we were doing. And that was it was so important to me that I decided this had to be something that I brought to the community. And so despite having a busy practice and my husband having to leave his job to stay home with the kids, the sick kids at the time, and teaching for IFM and basically a lot of stuff going on, I decided it would be a good idea to open an energy center. And nobody really told me how hard it is to be a small business owner. But I was probably surviving on 4 or 5 hours of sleep a night, and I knew it was bad, and I knew it was not sustainable. And in spring of 2017, I pretty much crashed. And I needed a 1 to 2 hour nap every afternoon just to get through my day. And don't get me wrong, I love naps. I think we should have siestas in this country, but that was kind of crimping my style a little bit. So even though I had my first Beamer 1 year ago, I was using it at the center. And I was busy when I went to the center, and I didn't have a Beamer at home until this past spring. And so in the spring of 2018, I decided it's time for me to commit to getting well. And I committed to 8 minutes twice a day on the Beamer. And within 5 weeks, I realized I no longer needed, I had gone 10 days, actually, without having a nap. So, and my back pain of 20 years was gone. So, yeah. So I use Beamer every day still 6 months later, and I rarely need a nap, though I still love naps. And I basically have been gifted the gift of time and energy to spend with my family, my patients, and occasionally a little bit on myself. So in my clinical practice, 3 of the big things that I'm really finding success with using Beamer are for pain. I was told I could say that as a physician. Energy and detoxification or waste removal, which when I went to medical school, I was told that's why you have a liver there's no need to do any more detoxification. But we all know there's a lot more to detoxification than just the liver. So for pain, I find the use of Beamer quite effective for new or long-standing pain, for elite athletes or the weekend warrior, in literally any sort of pain from head to toe. So a quick story, I do small groups at my center, partly because I don't have any money to advertise, and it just gets people to know what we do. And then I get to know my community a little bit. So I had this spring a group of 6 women, and they come and I give them a little tour of the center. I provide appetizers. There might be a little bit of wine involved. And we sit in a circle and we hang out and talk, and everybody does the Beamer. So 5 women went on my Beamer in pain. They had either a knee issue or a tendon issue or a shoulder issue, and 4 of the 5 came off without pain. So it was then that I realized, whoa, this is way more powerful than I thought. I was utilizing it in a complex chronic disease setting, expecting it really to take time, and here I'm seeing one application and improvement, if not resolution, of the issue. Second thing is energy. Clearly my story, I have a lot more energy. I see a lot of patients with chronic and complex conditions, including a lot of autoimmune conditions. I'd encourage you to look at PubMed. You can search multiple sclerosis and Beamer and find a great study on improvement in energy in multiple sclerosis. And I do utilize Beamer as an augmentation for our protocols. Finally, detoxification. Given all that I've been through with my kids, I've developed a great interest in Lyme and tick-borne illness. Wisconsin is the 2nd leader, next to Connecticut, with Lyme and tick-borne illness, and there aren't many docs doing it. And so I'm probably about the only one in southeastern Wisconsin still in an insurance-based setting. I have a 9-step protocol for helping folks to heal from tick-borne illness, and detoxification is a huge piece of that protocol. So whether I'm using antibiotics or antimicrobial herbs and all of the nutrition and other pieces that we use, I need things like Beamer to help people with detoxification, because otherwise when these bugs die off, these patients feel so sick, headaches, fatigue, aches, and they just can't get through the therapy. So Beamer really helps them to complete their protocol. So that's all I have. I'm really excited to be here. Thank you, and we're going to have fun with this Q&A.
Thank you, Dr. Renolds. There you go. Dr. Renolds, first, you and I are both functional medicine doctors, and so as a truly integrative practitioner, what have you seen the benefits for your patients both in and out of your clinical practice with Beamer use?
What have I seen, did you say as benefits?
So what have you, yeah, as far, and no specific diseases or anything, but in general, as an adjunct therapeutic, a therapeutic modality, what type of positive impacts have you seen in addition to your other pharmacological, nutraceutical interventions, other type of modalities? In addition, if you could also touch on the relationship of ozone and the other type of, what was it? Ozone and HBOT in combination.
Sure.
Yes, thank you.
So some of the other energy therapies that I do at my center is hyperbaric oxygen therapy and ozone therapy, and then, of course, Beamer. So they do work really nice in conjunction with each other. And I think one of the things people always wonder is, does it matter if you do Beamer before or after? And I don't know. But I typically recommend Beamer before they get in the hyperbaric chamber. It just makes sense to me that we're improving blood flow before they get in the chamber, where we're then pushing oxygen into the system. So, but either way, if they can just do it, it's best to just get a Beamer treatment in. But I've had a lot of success using it to help people get through difficult treatment protocols. Really helpful for energy and pain. So.
Yes, and do you think it makes a difference utilizing Beamer either before, during, after either HBOT or ozone therapy?
Yeah, so I mean, I'm not sure, but I try to do Beamer before.
From your clinical experience, of course,
yeah.
yes.
Yeah. So
okay, good. Okay. Dr. Reynolds, I know that in addition to being an incredible physician, I've never seen you, of course, but I've heard a lot about you. We've been colleagues in functional medicine for a while. As a doctor, which means teacher, and as teachers and doctors, we're responsible for passing on the baton as it relates to knowledge and clinical pearls to future doctors. Do you train or educate or plan to train and educate doctors, students, or colleagues in this adjuvant or adjunctive use of beam revascular therapy?
Yes.
Good answer. And next, many people think as far as learning that these are students. But the fact of the matter is we're all students. And so talk to me a little bit about how you would deliver this possibly to a medical student versus somebody who's been in practice 10, 20, 30 years.
Okay, so I've been a faculty member with a family medicine residency for the past 16 years, and we're affiliated with UW-Madison. And yesterday there was a lot of talk about obstacle and opportunity. Yeah. And I've taken some pretty big leaps in the past few years, and doing this energy center was a big thing. And I have to say there were some raised eyebrows among my colleagues, like, what is Dr. Reynolds doing now? And so I do tread gently, but we have an integrative medicine training arm to our residency program, and I think that's a big part of what's kept me in the conventional medicine setting, because I feel like I have something that I need to share with the world, and there's only one of me. I haven't figured out how to clone that yet, clone myself and do this, see more patients. I can't. So I think these young physicians need to come out at least with an open mind. They don't need to do everything that I do, but they need to have at least seen it, and when they get out there and somebody asks them about PEMF or any of these things, they're not going to just look at them like, you're crazy. They're going to look at them with an open mind and say, oh yeah, I think I heard about that in my training. So that keeps me doing what I do.
Thank you. Yep. Thank you for sharing that. And thank you for putting...
I want to thank you for watching this video. If you did like it, go ahead, hit the like button and subscribe to this channel. Once again, thank you for watching the video.